Bradley Chubb of the Miami Dolphins suffered a non-contact knee injury yesterday against the Ravens, and at the time of the injury, there was speculation as to what the severity of this knee injury was. Unfortunately, it looks like sources have confirmed that he's dealing with a torn ACL, which is going to end his season. The positioning that his knee went into is something known as a dynamic knee valgus, and this is an extremely risky position for the knee and the affected ligaments, and that's something I really want to focus on with today's video. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Gallo, and I'm a doctor of physical therapy. With my channel, I take a look at sports injuries and I explain them so that they're a little bit easier to understand. Also go over the relevant anatomy and what that person should expect moving forward when in rehab. If you enjoy this sort of content and you want to see more of it, please hit that thumbs up and subscribe to the channel because I will be making more of these in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you yourself have dealt with a torn ACL, go ahead and comment on your experience below. So we see here on the injury video that as he's going to try to make the tackle, he's going to plant with that right foot and that right knee is just going to cave in very awkwardly. Here I've got a model of the knee joint, and so the knee is formed by the thigh bone, also known as the femur, that's going to come down and form that top portion of the knee. Then we have our tibia, also known as the shin bone, that's going to come up and form the bottom portion. As we flip the model laterally, we also have the fibula bone as well. And essentially this is going to comprise the knee joint. There are four main ligaments located in the knee that essentially contribute to overall knee stability. The first one, and the one that's most relevant for this video, is that anterior cruciate ligament, also known as the ACL for short, located right in through here. As we flip the model medially or towards the inside, we have the medial collateral ligament, also known as the MCL. As we flip the model laterally or towards the outside, we have the lateral collateral ligament, also known as the LCL. And finally, as we look at the back of the model here, we have our posterior cruciate ligament, also known as the PCL for short. Inside the knee joint here, we also have the medial and lateral meniscus. You can think of these essentially as pieces of fiber cartilage that are going to act basically as shock absorbers between the femur and tibia bones. Now, once again, the specific position that Chubb's leg went into is known as a dynamic knee valgus, so I want to go over that briefly. This is characterized by a number of different motions located within the lower leg here, but a couple of the major motions that are going to put somebody in this position are known as external rotation of the lower leg. So you'll see that the foot essentially is going to rotate outwards. While the person's foot and leg are doing this, their femur is going to be internally rotated. And you can see here that as I do this, that's placing a lot of rotational stress going through the knee joint here. And as you can see in here, as I'm putting this through that rotational stress, that is absolutely pulling on that ACL. The ACL has a couple functions within the knee. The first one is that it's going to prevent any sort of anterior translation or anterior movement of that tibia bone. And then also, in addition to this, it's going to prevent any sort of rotational motion going through the knee. Any of the other ligaments in the knee could be essentially affected when somebody goes into this dynamic knee valgus position. It can also affect one or both of the meniscus that are located within the knee, but it's really important to say that because the ACL is going to prevent any sort of rotational force going through the knee, it is absolutely at risk for injury when in this position. There is an in the clinic or on the field test we can do for somebody with a suspected ACL tear, and this is known as the Lockman's test. So essentially what we're going to do is we're going to stabilize the person's thigh, and what we're doing here is we're going to pull that person's tibia and or lower leg toward us. And if we feel any laxity compared to the non-injured side, then this makes us think that the person is, of course, dealing with an ACL tear. This is absolutely going to be confirmed with an MRI, and that's exactly what happened in Chubb's case. And this brings us to our grading system when it comes to these ACL injuries. They are grades 1, 2, and 3. In a grade 1 ACL injury, you're getting stretching of the affected ligament. In a grade 2, this is where you're getting partial tearing. And finally, in a grade 3, you're getting a full rupture. A full rupture, unfortunately, is the worst case scenario, and that seems to be what Chubb is dealing with at this time. This is going to require surgical intervention because essentially what needs to happen here is that person needs to have a full ACL reconstruction. After the ACL reconstruction is formed, usually when the person comes to physical therapy, if no other structures in the knee have been damaged, they're going to be in one of those big drop lock braces that are going to extend from the ankle going all the way up the thigh, and they're going to have some range of motion precautions depending on the surgeon. Then when the person has advanced a little bit in physical therapy, we can start to work on range of motion. We'll start to work on re-educating the quad muscle. And finally, as they start progressing, we can slowly start to add in more functional and sport-specific movements. The total process to rehab an ACL can take anywhere from about 8 to 9+ months. It really depends on what the person wants to get back to doing. So unfortunately, as of right now, it looks like Chubb does have a long road ahead of him in terms of recovery. If I happen to hear any updates about his recovery process, or if there's any more information regarding his case, I'll be sure to update everybody in the comment section. Also, if you happen to hear anything, please feel free to update me as well. So we wish Chubb the best of luck moving forward. We hope that he makes a full recovery and that there's no other complications. Thank you so much for watching my video today. If you enjoy this sort of content, I'm going to go ahead and link another one of my playlists so that you can watch some of the other injuries that I've talked about. Thank you again for tuning in, and I'll see you next time.